Welcome to Modern Aesthetics, the podcast. Despite current economic uncertainty, business is good for most plastic surgeons. According to new statistics from the American Society of Plastic Surgeons, more than 3/4 of cosmetic-focused plastic surgery practices are seeing more business than before the pandemic.
So our survey analysis for 2022 showed that the top cosmetic procedures last year were liposuction, facelift, breast augmentation, tummy tuck, and breast lift. Those were the top five.
That's ASPS member Dr. Bob Basu, one of those plastic surgeons seeing an uptick in business. After preparing for the worst when COVID hit, he says his Houston, Texas practice was pleasantly surprised with the incredible surge of demand for cosmetic services, both surgical and non-invasive, once offices were allowed to reopen.
Based on my own personal experience, I've seen a significant increase in what's mommy makeover surgeries. Now, mommy makeovers are not an individual procedure. It's an umbrella term for combined procedures of the breast, the tummy, and or other areas. And so I've seen a significant increase in requests for mommy makeover procedures and a request for combined procedures, particularly for massive weight loss, post weight loss body contour.
So what's driving this growth? The ASPS data show it's a variety of things, from patients wanting to look and feel better about themselves. And, of course, the Zoom boom is real. But will it continue? Or will inflation and an economic recession shift patients' spending away from elective cosmetic procedures?
Well, I think what's driving increased demand for all cosmetic procedures is a couple things. Well, number one, we know during COVID that patients or people were working from home, so this opened up an opportunity for them to do something for themselves. We know that they weren't traveling, so a lot of vacation plans got canceled, and so patients had saved up enough to finally do some things for themselves. And I think culturally we've experienced something very different in this country, in which now there's an increased emphasis or focus on aesthetics and wellness. And so people are now saying, "Hey, it's time for to do something for myself, so I look and feel better and feel more confident." So I think there are multiple things that are leading to the significant increase in cosmetic surgery and cosmetic treatment demand. I do think this trend for increased interest and demand for cosmetic services will continue, and we're seeing that initially when patients started or people started traveling again and started taking vacations. Finally, I thought that we would see a little decline in demand, and that has simply not, pleasantly for us, that has simply not been the case. We're still seeing very strong demand for surgical and non-surgical treatments. Now, I do have to recognize, we all have to recognize that we're seeing record inflation. We're in a recession, so we've got significant economic headwinds. And if history tells us anything in the past, with any downturn, this does have an impact on on the aesthetic consumer mindset, and it should have should have an impact on aesthetic demand. I do believe that the economic impact will vary from different markets and to different degrees, depending on the local economic ecosystem and the dynamics. But I do think that the desire to do something for oneself will still stay strong. And given the economic headwinds, perhaps patients will opt for financing options rather than using their cash to opt for a procedure, or they may hold off on larger combined procedures and maybe do one procedure, or maybe opt for a non-invasive treatment. So we'll see how this evolves over time.
As demand for cosmetic procedures is expected to continue, the aesthetics industry continues to meet this demand with new products and treatments, and by finding ways to improve current treatments to make them safer for patients.
So what's really exciting is we're seeing a lot of innovation in the non-invasive space, both with respect to fillers and also botulinum products. And Daxxify is the new headline, which provides an option for daxibotulinum to last about 6 to 9 months. I do believe this will have some impact on the market. I think there's a segment of the patient population that does not want to come back every 3 to 4 months for their Botox treatments, and they will opt for something that lasts longer. That said, I think the product impact of Daxxify will really depend on the price strategy that Revance opts for, which I'm not familiar with at this time. There's some patients that will choose to have a lower priced option, and they don't mind coming back to a practice because they enjoy coming to that practice and opting for other treatments as well. But there will be a small segment of the population that will opt for a longer lasting treatment. So we'll see how this shakes out. I think that right now, the hot topic in patient safety and cosmetic surgery is the integration of ultrasound, particularly for gluteal augmentation, so that we can do everything possible to make the procedure as safe as possible. As you know, there's been a lot of headlines about fat emboli and the catastrophic mortalities that occurred in these high volume clinics, particularly that are doing a lot of gluteal augmentation procedures, fat transfer, also known as the BBL procedures. And so the societies have all worked together to recommend if you are doing gluteal fat transfer procedure, the fat be injected only into the safe zone or the subcutaneous space. Well, let's take that one step further. Now the societies have come together and have collaborated to recommend that surgeons performing BBL procedures utilize intraoperative ultrasound so that we can actually visualize where we're injecting the fat to do everything humanly possible to keep our patients safe. So I think that's exciting that we're seeing incorporation of new technologies to make patients safer or procedures safer for our patients.
Speaking of safety, the ASPS has been on top of keeping physicians and patients informed about safety warnings about breast implants.
So there's two issues here. There's one, which is breast implant associated ALCL, which is that lymphoma that's been linked with textured implants. The good news is there are no reported cases of isolated smooth implants leading to breast implant associated ALCL, to my knowledge. The most recent statement from the FDA was essentially a statement about breast implant associated squamous cell carcinomas. There's, I believe, approximately 20 cases that they have found through different studies and reporting where they've found squamous cell carcinoma in the capsule around both saline and silicone gel implants, both textured and smooth shell implants. Now, this is just a report of the number of cases. And to alert all stakeholders, including our societies and board certified plastic surgeons, about this so we can continue to collect data. But this is not new information. And so more study needs to be done to see if there's any association whatsoever. At this time, the FDA has reiterated that breast implants are very safe. But breast implants are the most regulated and studied devices in all of medicine. And so this is a good thing for our patients. We have a lot of safety data about them. And so I think the American Society of Plastic Surgeons and our other plastic surgery specialty societies will work together to continue tracking data and following this closely.
Thank you for listening to this episode of Modern Aesthetics, the podcast. Listen to future episodes at modernaesthetics.com or subscribe wherever you listen to podcasts.